How are you doing? Okay. My name is Dr. Calliope, and I'm going to be performing your annual wellness checkup today. All right? Okay, so I'm just going to sanitize my hands real quick. Okay? Did you get here okay? Yeah, I can hear the wind howling outside. Glad you didn't get blown away. Here we go. So for our annual wellness checkup, this is somewhat similar to your normal physical examinations, except that it's a lot of question and answer as opposed to actual examination. So I have a fairly detailed list of different health questions to ask you, and we are just primarily gauging your general wellness, right? Your general health. We're looking for any red flags to address. We are determining if at this point we need to do any screenings or we need to plan for those in the future. And we will be doing a little basic examination as well to make sure that you are in the right place, that you're as healthy as you can be right now, okay? All right. Any questions so far? Okay, very good. So, I'm going to ask you a lot of questions. It is imperative that you answer them as honestly as possible, but if you feel uncomfortable with a question, you don't have to answer at all. I would rather you omit an answer rather than lie about it, just so that we don't have any potential mix-ups, okay? All right. So firstly, if I could just have you confirm your name for me. Okay, very good. Alrighty, and your date of birth then? Okay. Alright, excellent. And that makes you how old? Okay, wonderful. And to jump back to your name, is that your preferred name? Do you like to go by that? Okay, and how do you like to be addressed? Okay, very good. All right, so we're going to get into our medical history portion. So, are there any past health issues that you've dealt with? Okay. All right. Okay, and do you have any time frame for those, even just giving me a year or an age? Okay. All right, and was that resolved then? Okay, very good. Do you have any current acute or chronic conditions? Okay. Okay. All right. And do you have any sort of mental health concerns or diagnoses at all? Okay. All right. Very good. Okay. Any past injury or surgeries at all? Anything you would have had to get medical attention for broken bones, things of that nature. Okay. All right. Yeah, I would say wisdom teeth surgery, we can just put that down. It is a surgery. So that's something we can pop down. Okay. Any current prescription medication use? Okay. And what about over-the-counter medication use? Okay. Yeah, this is even things if you have to regularly take pain medicine, for example, allergy medicine, cold medicine, things like that. Yeah, this time of year I feel like all of us are kind of dealing with something, aren't we? Yeah, it's just that time of year. Do you have any vitamin or herbal supplement use at all? Take any extra vitamins, a multivitamin, or any sort of herbal supplements? Okay. Very good. Do you have any sort of allergy to any medications at all? Okay. And what about any food allergies? Okay. And what about any environmental allergies? All right. Okay. Are you working or are you a student at all? Okay. What is it that you do? Okay. All right. Any alcohol use, and if so, how much and how often? Very good. Any tobacco use, and if so, how much and how often? Okay, and what about recreational drug use? If so, how much, how often, and what do you use? Okay, very good. And how would you consider your diet? Do you feel that you have a fairly unhealthy diet, average, healthy, anything of that sort? Okay. All right. Are we getting our fruits and vegetables and whole grains and whatnot? Okay. Do you have any restrictions with that diet at all? Anything you're sensitive to or have any intolerances to? Okay. All right. And do you get exercise throughout the week? Okay, and what does that look like for you in a given week? Okay. Right. Yeah. Yep, exercise is absolutely integral to our health. Whatever we can do, right? Even just some walking is good. Even just being able to periodically get up through the day if we have a particularly sedentary lifestyle, being able to walk around a little bit here and there, that's a good thing. That's a good thing for humans. Do you know if you are up to date on your vaccinations? Okay. Very good. And what is your height and weight? Okay. All right, very good. So that was quite a few questions for you. And now we're going to go ahead and move on to our examination portion, okay? So, for the next part of our wellness exam, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, excellent. So I am going to pop on a pair of gloves real quick. Just real quick. And then we will move on. We're going to check your vital signs first off. All right. There we go. All right. Let's go ahead and start with your temperature. I'm going to have you open your mouth for me and lift up your tongue. I'm going to put this at the bottom of your mouth here. I want you to lay your tongue down on top of the thermometer, and we'll just sit here for a few moments. Very good. Okay. I'm just going to note that down. All right. Now I'd like to take your pulse and respiration rate. So I'm just going to have you hold out one wrist or the other, doesn't matter, okay? And I'm just going to place my fingers along your radial artery, and we will count the beats. All right, very good. So resting heart rate's about 80 beats per minute, and respirations are well within normal limits. Okay, so now I'm going to take your blood pressure, okay? So I've got our sphygmomanometer here, and I'm going to pop in a stethoscope. So let's go ahead and get this all wrapped around your arm, okay? Do you have a preference as to which arm I use? Okay. Okay. And I've got the dial and my stethoscope on your arm, and we're going to inflate the cuff. And let the air out. Okay. Let that go. We're going to do that one more time, okay? And let it go. And there. Okay. All right, very good. So I'm going to go ahead and take the cuff off. very good. So we're going to start with a very general inspection, okay? So I'm going to sit back a bit. I'm going to look at you as a whole, all right? Okay, so let's see. Alright, so now we're going to move on to the hair, skin, and nails, okay? And look at the integumentary system. So I'm going to start with a hair examination, okay? I just want to check the quality of your hair, and I'll take a look at your nails on your hands. We'll take a look at your skin as a whole, and I'll look to see if there are any moles that we need to keep an eye on, alright? So I'm just going to get up. And I'm just going to start with looking at your hair here, okay? And I want to check quality of the hair. Make sure that it has good characteristics of your particular hair type. Okay. A lot of health problems can show signs in our skin, in our hair, in our nails, especially different cardiac conditions can show up in the nails pretty easily. That's something we like to watch out for. Okay. All right, so I'm gonna have a little look. I know I'm a bit close. There we go. I'm gonna have a little look at your skin, okay, while I'm here. So I'm just checking around your scalp and around your ears as well. Behind the ears is where a lot of lesions like to lurk. I want to make sure we don't have anything like that occurring. Okay. All right. Have you had any moles that have changed color or shape at all recently that you've noticed? Okay. If they do, you can give us a call and we can get those taken a look at. Hear that wind? Isn't that something frightful? Nothing like a winter day in the Midwest, Right. Let's see. Okay, so I'm just checking along your neck, top of your chest here. any place that regularly gets sun exposure. Your arms. Okay, and if you could hold out your hands for me so that your nails are up towards the ceiling. Okay. Just want to check the quality of the nails as well as the capillary refill. Okay. Very good. All right. So I'm just going to make a note of that. Okay, we're going to do a little eye examination. Nothing too drawn out, but I'm going to be employing the use of a pen light here. Alright, so first I'd like to just take a little look into your eyes, okay? If you could just look straight ahead for me at my nose here. Okay, and I'm just going to very slowly bring this in. Okay. Have you had any vision changes at all recently? Okay. Do you wear glasses or contacts? Okay. Do you experience any eye pain or strain? And do you spend a lot of time looking at screens? Okay. Alright, so now I'm going to have you still look ahead, and we are going to do the direct consensual response test. I'm going to put my hand up in between your eyes. I'm going to shine my light into one eye, and that eye should react to the light being directly shown into it, and that would be your direct response. At the same time that I shine this light into this eye, the other eye should react in the same way at the same time, and that is called our consensual response. Alright? Okay, so I'm just going to put my hand up between your eyes here. Okay? There we go. And I'm just going to look at the direct response and the consensual response. Very good. Direct response. Consensual. Very good. Okay. So I'm going to have you pick a spot on the wall. I want you to focus on that spot. And I'm going to come in with my light real close. I'm just going to swing it back and forth. Back and forth. Back and forth. Okay, very good. So if I could have you look at the wall behind me. Okay, look at the light here. Good. And follow the light as I bring it in and out and in and out and in and out. Good. Look on the wall over here. And look at this light. Okay? And follow it as I bring it in and out. In and out. And in and out. Very good. Okay. So, I'm going to get a little closer and we're going to have a little inspection of the ears, okay? Just real brief, since I took a little look at them with our little skin check, right? But I just want to have a little look here. Have a little look at the ear. Just a little peek. Just a little peek. And the other. Just a little look. Just a little peek at the ear. Okay, so we're gonna do a short little hearing test, okay? So I want you to close your eyes for me, okay? And I want you to raise the hand of the side that you hear me rustle my fingers on, okay? All right. Good. Brilliant. Perfect. All right, I'm going to be whispering some words. I want you to tell me what those words are, okay? All right. Green. Okay, what were those words? Very good. Red. Orange. Yellow. And what were those words? Okay, very good. All right. Lastly, I want to do a little tuning fork hearing test. I'm just going to strike the tuning fork. I want you to let me know what side you hear it on, okay? Good. Good. Very good. Okay. Good. Good. All right, that's very good. I think that your hearing is in great condition. Okay, so now we're going to have a little look at your nose and your throat and your mouth, okay? So I'm just going to pop on my little otoscope head on my little light tool here. And now that I think about it, I don't believe I looked in your ears, did I? I didn't. So let me go ahead and get a speculum. Okay? And we're just going to have a peek inside them real quick, okay? Alright, so I'm going to start here. Just pull up and back on the ear canal. And then just gently look into your ear, okay? Alright. Just making sure the tympanic membrane is in good condition. The ear canal is in good condition. And that there isn't a buildup of cerumen in the canal. Okay, I'm just going to pull that out. Alright, and the other side. Okay, just pulling up and back and inserting the otoscope into the ear canal. Doesn't take too much time, just a little bit, but I just want to make sure that there aren't any perforations, that there isn't any irritation or swelling or signs of infection. Okay, there we go. While I didn't find anything, it's a good thing that I checked anyway. I'm going to take off the speculum and I'm going to use this just so that I can get a little look inside your nose, okay? If you wouldn't mind just tipping your head back for me. Okay, and I'm just going to have a little peek, just a little peek inside of your nose. Okay. Very good. Alright, so the septum is intact. There isn't any redness at all. Okay. I think that looks good. Okay. You can go ahead and tip your head back. Alright, so now I'm going to have you open your mouth for me. I'm going to press your tongue down. And I'm going to have a little look inside of your throat and your mouth, okay? So, just take a little look here. Would you mind saying ah for me? Good, okay. Alright. Your mouth looks to be in good condition. I'm not seeing any signs of sores or lesions. Okay, the teeth look good. Right, okay. And you can go ahead and close your mouth, alright? Alright, and I'm going to go ahead and check your lymph nodes, okay? I'm going to start with the ones in the back of your head and work my way forward and down, okay? Have you gotten over any infection recently? Or have you had any cold? Anything like that? Okay. So I shouldn't really feel any distension in the lymph nodes. Okay. Down to the clavicle. Okay. Very good. So yeah, there's not any sort of distension that I'm finding, which is good. No swelling. Changes there. Okay. So now we're going to bring the stethoscope back into play, and we're going to do a little auscultation of your heart and your lungs. All right? Okay. You doing okay so far? All right. Very good. If at any point you need a little break, just let me know, okay? Okay. Okay, so let's go ahead and pop this back in. All right. So I'm going to examine your heart first so you can breathe normally, all right? So I'm just going to be taking a listen to all the valves of your heart, as well as Erb's point. So the different valves like the mitral, tricuspid, the pulmonary, and the atrial. Just taking aortic, rather, not atrial, aortic. Just taking a little listen to all of those. Okay. Very good. Now I'm going to listen to your lungs. I'll have you take a deep breath when I prompt you and exhale when I prompt you, okay? All right. Take a deep breath in for me. And out. Deep breath in. 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 And out. And if you could just lift your elbow a little bit on this side. Okay. Deep breath in. And out. Okay, you can put that arm down, and if you could lift the other. Deep breath in. And out. Okay. Okay. Very good. So just a brief check. Listen if there are any issues with your lungs and your heart. Okay. So I'm just going to have you lay back on the table, and I'm going to listen to your abdomen, okay? All right. So I'm going to pop this back in while you get all situated. Okay? All right. So I'm going to take a little listen to your abdomen. Just breathe normally for me. You're doing really, really well. Just listening to the 4 quadrants. Okay, and I'm going to do a little bit of palpation, okay? I want you to let me know if anything is tender or painful, okay? Alright, so I'm just going to feel around your tummy a bit. And I'm going to feel a little bit deeper. It might be a bit uncomfortable, okay? But it won't take too long, right? Still doing okay? Okay, almost done. Okay. You can go ahead and take a breath. I know that's not ideal, right? So when you're ready to, you can go ahead and come back up to sitting. Okay. So we're gonna do a little bit of exercise, if you will, okay? So we're going to do a little musculoskeletal examination. I'm going to have you do some different movements. I want you to let me know if there's any pain or discomfort in any of this, okay? Alright, so if you could just drop your head as far down as possible, okay? Without hurting yourself, of course. And if you could tip your head back. Good. And if you could go to your left shoulder. I know that's not your left, it's my left. And the other side. Okay. And if you could tilt your head to one shoulder and the other. Good. Any pain or discomfort in any of that? Okay. If you could just hold on to my hands here, squeeze them as tight as possible. Okay, very good. All right, if you could just roll your wrists around for me and back. Okay, can you cock them all the way back and go all the way forward? Very good. Any pain or tenderness in that? Okay, very good. And if you could just move your arms up and down for me. Okay, you could have them up like this, right? I'm going to try to pull you towards me. I want you to resist me. Okay, and I'm going to push against your arms. I want you to resist me. Okay, very good. And while I'm working on your arms, I'm going to test a couple of reflexes, okay? If you could just let your arms relax, all right? I'm going to grab one. I'm going to put my hand around your elbow and my finger in the crook of your elbow, okay? Just relax your arm. Very good, okay? And then I'm just going to lift this arm up and just relax it, okay? Okay, I'm going to put that back down. And we're going to do the same thing on the other side. One hand wraps around the elbow, thumb on the crook of elbow. Okay, and I'm just going to lift your arm up. I want you to let me take the weight of it and relax it. Very good. Okay, so biceps and triceps are looking good in the reflex area. So now I'm going to have you hold your hands, your arms out to the side. Okay, can you go forward? All the way back and all the way above your head. problem with any of this? Okay, very good. I'm going to move down. So, got your legs here. And let's go ahead and start with your toes, okay? So, I'm going to put my hands on top of your toes and I'm going to try to push them down. I want you to push them upwards, okay? Okay, very good. And I'm going to try to lift your feet up. I want you to resist me and push them down. Okay, very good. So, I'm going to grab a little blunt end of the reflex hammer and we are going to work on a reflex on the bottom of your foot. Do Babinski's reflex. So I want you to relax your foot and I'm just going to stroke up the foot. Okay. And the other side, stroke up the foot. Okay. And then we're going to do the Achilles tendon reflex. Okay. All right. And if you could roll your ankles around for me. And the other way. Okay. And I'm just going to lift up your leg. Any pain or tenderness in this? Okay. I'm going to do the other side. All good? Okay. Almost slid off my chair there. All right, I'm going to put my hands on top of your thighs. I want you to try to lift them up against me. Okay, very good. And finally, I'm going to go ahead and do your knee-jerk reflex. So just let your legs relax. All right, so finally I'm going to do just a brief spinal examination. I'm going to get up and I'm just going to move our table out of the way and I'm going to come to the back of you here, right? And I'm just feeling along the spine here. Very good. All right. So now I'm going to have you get up for me, okay? And I'll have you turn around. All right. I'm going to have you bend very slowly forward, okay? And I'm just going to feel along your spine. Okay, now if you could come very slowly back up. All right, okay. And you can turn back around and face me. So the last thing on our checklist here is we're going to do a little balance and coordination test, okay? I'm going to have you walk to the other side of the room, just normally. Okay, and if you could come back but walk on your toes. Very good. And if you could go back and walk on your heels. And finally, if you could come back but walk heel to toe so that your toes touch your heels of your other foot. Okay, very good. And if you could just stand still and close your eyes for me. right, I will catch you if you fall. All right. Okay, you can go ahead and open your eyes and sit back down. Alrighty, very good. So overall, everything looks really good. You look to have very good health for your age. Everything is age appropriate, and I'm not seeing anything we should be concerned about. So with any of those moles we talked about, if they change shape or size or color, that you can call us and make an appointment for that, okay? So there aren't really any screenings coming up. So I'm thinking, let's see. Yeah, I think besides just keeping an eye on those moles and your regular annual physical examinations and regular routine blood work, otherwise that should be pretty good. So just keeping up on getting your flu shot, things like that. There isn't really anything else that you need to be worried about at this time. So that's really good. That's good. We have a little plan together. All right. Do you have any questions, any concerns for me at all? Okay, very good. So if you don't have anything else and we don't have anything else to plan out, then that will conclude our session today, okay? All right. So thank you so much for coming into my clinic to receive this annual wellness checkup. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.